Okay, good morning and welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. And today onwards, we will start with another important topic, that is approach to hepatobiliary disorders in children. Approach to a patient of hepatobiliary disorders in children. This is one of the very important topic. Now, so let us start with the first slide. When we have hepatobiliary disorders, the most common symptom which is present in the hepatobiliary disorder is usually we will say jaundice. Okay, that is yellowish discoloration. And Ayurveda also says the same thing. Pita, Vindmutra, Netra, etc. So yellowish discoloration of the different body parts. So that is one of the most common symptom. So let us start with that only. See, yellowish discoloration of the skin and the sclera and the mucous membrane is usually called as jaundice. And jaundice is one of the very prime symptom of hepatobiliary disorders, any kind of hepatobiliary disorders. Now, we have different words like jaundice, then also we have got a word like icterus. Okay. So now, what is the difference between this jaundice and icterus? Actually, they are one and same. The word icterus is the term which is used. Actually, the icterus word, that is actually Latin word. It is a Latin word. The meaning of the Latin word is, in Latin language, is that a yellowish beak of the bird. That means a bird with yellowish beak. Okay, that is the meaning of word icterus in Latin language. So practically, jaundice is more commonly used term and icterus is more medically used term. That's all. Otherwise, there is no much difference. But the question is, but the skin is also pigmented by many other things. Now, whenever you find yellowishness in the body, maybe in the sclera, maybe in the mucous membrane, maybe in the nails, maybe in the palms, not always it is jaundice. So practically this is very important for us. Okay. So whenever there is yellowish pigment is there in our body, in different parts of the body, it is not always jaundice because of hepatobiliary disorders. One of the most common thing is keratonemia. Keratonemia means this occurs in excess intake of the carrot. Because carrot contains yellowish pigment, so after intake of excess amount of the carrot, so there is every chance that there may be passing of yellowish urine, there may be yellowishness in the different parts of the body, in the sclera also is there. Continuously when you are taking carrot in excess, it is possible. Okay, so this point is always kept in mind. All yellowish discoloration is not jaundice. Okay, there are so many simple things are there which can also cause yellowish discoloration. For example, yellowishness of the urine may be caused by different drugs. And if you take a B complex medication, yeah, definitely the urine color will be yellowish. Okay, some of the drugs like rifampicin, etc., the antitubercular drugs, so they cause the lemon color to the urine. Okay, so therefore there are so many other facets are there which can cause yellowish discoloration. Now, if normal bilirubin is 0.8 milligram, so if the normal bilirubin is 0.8 grams, so then it is normal. Okay, so when the normal bilirubin level crosses more than 2, then it is abnormal. This is a what is a cutoff mark for us. Okay, so this much we should always in our mind. Normal bilirubin level is 0.8. Okay, but if it is increasing more than 2, so then we have to be worried. But when it increases more than 2, definitely there will be appearance of yellowish discoloration in the sclera and different parts of the body. First of all, we will have yellowish discoloration in the sclera. Okay, because it has got more tendency towards the bilirubin. So bilirubin initially go and get settled there. Okay, the scleral tissue, so they have got more tendency towards it. It contains some elastic tissues, and that elastic tissues have got more tendency towards the to stain with the bilirubin. That's the reason always whenever there is a jaundice in the sclera, it appears first. Now, another important thing is whether the jaundice is related with the hemoglobin or not. So this is very important. No, no. So same side is going.
एक भी नहीं आई सर वो
Okay,
फर्स्ट
okay,
फ्रंट
okay,
पे
okay, okay, okay. So whether the jaundice is it coming now?
यस सर
Hmm. So whether the jaundice is related to the hemoglobin or not, this point has to be made clear because see, usually why jaundice occur? Jaundice occur because of excess destruction of the RBCs. When there is excess destruction of the RBCs there, then the hemoglobin is get liberated, and this hemoglobin again divide into heme and globin will be get reabsorbed into the system, whereas heme will undergo metabolism. After the metabolism, from the heme Fe ions are produced. These Fe ions are also get absorbed into the body, but in the process of this metabolism there is production of the biliverdin, and that biliverdin will be carried into the liver and it becomes bilirubin, and then it is excreted. So this is happening in excess. When it happens in excess, then it leads to the formation of the jaundice. So what you have to understand is jaundice is most of the time will be there in such condition when there is excess destruction of the RBCs. Okay, not always only because of excess destruction of the RBCs. Sometimes jaundice may be also occur because of excess metabolism or excess destruction of the hemoglobin. Now it is obvious that hemoglobin is present inside the RBCs. Okay, there are some conditions where the whole RBCs get destructed or destroyed. There are some condition whole RBC is not destroyed, only hemoglobin will come out of that, and then that hemoglobin will be undergoing metabolism and production of the biliverdin, bilirubin, etc. So this point has to be kept in mind. These are some of the minute points that we will see one by one. Now, why does jaundice occurs? Ultimately, it may be RBC destruction or hemoglobin destruction. The RBC occur only because of the heme metabolism. Okay, this occurs because of the destruction of the HB and also heme metabolism. Now, every day, normally there will be destruction of about 1% of RBCs, because we know that daily RBCs are produced, daily RBCs are destroyed. Okay, if you take the average, about 1% of the RBC will going to die every day. Okay, suppose if you estimate about 1000 millions of RBCs are there, so 1% means almost all 1 million will be get destroyed every day. Okay, so when this much of RBCs are destroyed, definitely hemoglobin is liberated and the heme metabolism takes place, and a lot of biliverdin will be formed. But this much of if the destruction is only up to 1% per day, and amount of the bilirubin produced by this 1% destruction of the RBC will be well handled by the liver. There is no problem for the liver. No issues with the liver. It is able to handle this much of a amount. Okay. Otherwise, also in general, the liver can work about 6 to 7 times more than its capacity in emergency. Okay. 1% handling, 1% of RBC destruction handling, no issues for the liver at all. Even in case of emergency, if the number increases up to 6 to 7%, then also liver is able to handle this load. There is no problem. But if it is more than that, then the problem starts. Okay. So now, as I told earlier, globin will be reabsorbed by the bloodstream. So when the destruction takes place, metabolism takes place, heme again undergoes metabolism, and there is a release of Fe ion from that, which is again reabsorbed, and it is stored in the body in a different forms like hemosiderin, etc. Now, but in the process, what actually happens is there is a release of biliverdin. This biliverdin now will be carried to the liver from the spleen, because the destruction is taking place in this hemolysis is taking place in the spleen. Okay, and then the metabolism starts. So from the spleen, this particular biliverdin will be carried to the liver, and in the process it will combine with the albumin, and then after coming to the liver it undergo conjugation. So before coming to the liver, this particular biliverdin combined with the albumin, so it is usually called as a unconjugated. It is not conjugated, unconjugated, or it is also called as indirect bilirubin. Okay, but once it undergo conjugation in the liver, then thereafter it is called as conjugated bilirubin. Okay, because conjugation will takes place in the liver. Why it is brought to the liver? It is brought to the liver for the purpose of conjugation only. Okay, because conjugation enzymes related for the conjugations are present in the conjugation of the bilirubin is present in the liver. Therefore, it is brought to the liver. Okay, so liver can work about 5 to 6 times more than the normal capacity in emergency. Now, unconjugated. Now, what is the need of converting this unconjugated bilirubin into conjugated bilirubin? So why we have to give extra work to the liver? So unconjugated itself can be cleared from the body, no? So why it has to be brought to the liver? This is a big question. Okay. So question is, why unconjugated has to be get converted into conjugated? The reason is this unconjugated bilirubin is basically toxic material. Okay, there are three things are there. It is toxic, it is water insoluble, and it will go into stain in the different parts of the body. Okay, so especially it can able to stain the when the amount increases more, it can even stain the basal ganglia area. That is what exactly happens in case of kernicterus. In the newborn babies, the kernicterus, this is the problem. So this particular unconjugated bilirubin is basically a toxic material. It's a toxic material. So not only toxic, it is water insoluble. So when it is toxic and also water insoluble, so it cannot be excreted through the urine, because if you want to excrete something from the urine through the urine, then it has to be made water soluble. Otherwise, it is not possible. Okay, so so unconjugated is water insoluble and also toxic. Now, two things are required. One is this toxic material has to be get converted into non-toxic, and water insoluble material has to be get converted into water soluble. Then only this particular conjugation, this particular bilirubin can be excreted from the body, either through the fecal material or maybe through the urine or some other sources. Okay. So this is the problem. Therefore, it is brought to the liver. Therefore, it is brought to the liver, and liver will convert this particular unconjugated bilirubin into conjugated bilirubin. Okay, and make it non-toxic and also make it water soluble. So once it is made water soluble, then it can be excreted. Then we will get the color in the urine. Okay, so this is the reason. Now, mild icterus or mild jaundice like presentation, one I told that it can be seen in case of carotenoemia, excess consumption of the carrot, and as well as other yellowish pigmentation containing vegetables, etc. But there is another important condition, what is called as muddy sclera. What do you mean by muddy sclera? Muddy sclera means usually it will be seen in case of allergic disorders. A patient who is having allergy or some vitamin deficiencies, etc. So usually sclera will not have that particular normal brightness. Okay, so sclera portion, that whitish portion of the sclera, so that is not so bright, it is dull, and we will call this particular condition as muddy sclera. Okay, when the sclera is not bright, it is dull, then we will call it muddy sclera. Usually it can be seen in some of the storage disorders also, or it can be even seen in some of the allergic disorders. Okay, because usually allergic conjunctivitis, etc. will be there in patient who is having allergy and all, so there it will be seen. Okay, so normal brightness of the sclera is lost usually in some of the vitamin deficiencies, especially vitamin A deficiencies. Okay, in such case you can have this particular condition. And so this has to be differentiated. So now we have got another important differentiation. Always don't overdiagnose that this is a jaundice. Even in case of muddy sclera also, it gives an yellowish appearance, okay, and therefore it has to be identified. Similarly, sometimes this uh, dull sclera can be also seen in case of vitamin A deficiencies. In vitamin A deficiency, so usually it is related to the eye only, and but the presentation of the vitamin A deficiency, that means yellowish like appearance or muddy like appearance in vitamin A deficiency in the sclera, is not a sudden process. It is a very gradual process. It takes its own time. Okay, so in such case, there are 10 steps are there how a vitamin deficiency leads to different problems. I think you may be knowing that. Initially, there is dryness of the conjunctiva, then comes conjunctival xerosis, then comes night blindness, then there is formation of the bite out spots, then there is formation of the corneal xerosis, then there is formation of the corneal ulcer, then there is formation of the blindness. So these are the different steps. Okay, so how a vitamin deficiency proceeds. So vitamin deficiency is not only one single aspect, it contains these 10 steps. It's one by one steps. Okay, slowly they will go into proceed. So such type of progression will be seen if that particular dull sclera is because of a vitamin A deficiency. Now, keratonemia we have already discussed. It is also seen in keratonemia. This part we have already discussed. Now, another important issue related to jaundice is high urine or dark urine may be also there. Okay. Now, one more important thing related to hepatobiliary disorder is dark urine or high urine. High urine means what is the meaning of high urine? High urine means concentrated urine. Urine is more concentrated because we know that as the urine is more and more concentrated, the color will going to change. Okay. So now, patients pita wind mutra. Now we are talking about pita wind mutra. The only the urine of the patient child is get high color or dark urine, but there is no jaundice anywhere. This is possible. Patient is not having any jaundice in the sclera or other parts of the body, but still the patient is passing a dark urine. Okay, so this is possible in many conditions other than jaundice. There is no jaundice, but still patient is passing yellowish urine. Okay, so now what is the meaning of high color of the urine? High color means that is concentrated urine. The color is higher than the normal, therefore it's called as high color urine. Now, sometime a cola color urine will be seen. So that can be sometime confused with the, what you say, the high color urine, but more concentrated urine. Cola color urine is nothing but it is because of a bleeding from the kidney. Okay, when the bleeding spot in the kidney, the blood mixes with the urine and come along all the way through the to the urethra. When it reaches the urethra and the external opening, by that time the RBC's morphology will be changed. RBC will be broken down because it has to pass through the narrow passage of the nephron and all. So RBC will be broken down, hemoglobin comes out. Okay, then that hemoglobin heme will mix with the urine and it gives a different color, little blackish color. Therefore, it is called as a cola color. Okay, so this cola color urine is basically because of a kidney bleeding, as it can occur in case of glomerulonephritis. Acute glomerulonephritis. So this should not be confused with the yellowish urine or dark urine, rather dark urine. Sometime in the urine there may be reddish urine. Okay, reddish means it's a frank blood. Frank blood is mixed. Suppose if the cause is something somewhere from the urethra, okay, or bladder, then the blood will be very fresh. Okay, frank bleeding will be there. So this should not be also confused with the high color of the urine or concentrated urine. Okay. Now sometimes urine color may be excessively red or sometimes excessively what you say yellowish or high color in case of excess consumption of the beetroot also. Okay, So you may see beetroot, it is also having a higher pigments. Okay, it releases the color, no? When you put in the water, beetroot, it releases the color. So even consumption of the beetroot also sometimes leads to high color of the urine many times, and this should not be also confused with the high color of the urine, because this is because of the consumption of the beetroot. Now, as I told earlier, urine color may also change in some of the medications. Okay, urine color may become high or high color or dark color urine may be also seen in some of the medications. For example, B complex capsules. Normally, it is seen. Similarly, rifampicin, one of the anti-tubercular drug, the color becomes lemon yellow. Color becomes lemon yellow. Okay. Now, red color on the diaper may be also sometimes seen. Sometime if the child is the baby is wearing the diapers, in the diapers also sometimes red color can be seen. That is due to the urate crystals. Okay. And similarly, if the child is having UTI, then also the diaper may be stained. It is because when you have the diaper, there is no an option to see the darkness of the urine, isn't it? Baby passes the urine in the diaper. So sometimes all the urine is very darker, and if you find some blood spots in the diaper, so that is clear that it is not because of the hepatobiliary disorders, or it is not the dark urine, it is because of the blood only. And as we have already seen, this particular cola color urine can be seen in hematuria, or even in case of hemoglobinuria or myoglobinuria. Myoglobin means something related to muscles. In the muscles also, muscle proteins, so they also contains hemoglobin to some extent. It's muscle cells. That's called myoglobinuria. Myo refers to muscles. In all these conditions, there will be blood is involved. Okay, but in hematuria, it is fresh blood, and there will be RBC on benzamine stain. That we'll see later. Okay. Uh, okay, this part we will see later. Now we come to the next part, that is types of the jaundice. Okay, types of the jaundice, because we are discussing about hepatobiliary disorders. So now we will see the type of the jaundice.